So hello, everyone. It's so nice to see you all again. Welcome to our 19th virtual orientation session, which is Wellness Wednesday. My name is Jen Abraham, and I'm the graduate intern for new student transition programs here at Seton Hill University. I will be working with you throughout the virtual summer orientation to get you started on your path. So today we have Annette, who is our Director of Health Services, and we have Terri, who is our Director of Counseling and Disability Services, and they're going to take you through Wellness Wednesday. So thank you both so much for being here tonight.
You're welcome. So Annette, why don't you go ahead and start?
Okay, so good evening, everybody. It's nice to see some of your faces. Thank you for taking the time to meet with us this evening. As Jen and Terri stated, my name is Annette Smych. I am a board certified family nurse practitioner, and I also serve as the Director of Health Services. I'm so happy to be here. I am starting my 6th year at Seton Hill. I have been a registered nurse for 35 years and a nurse practitioner for 23 years. So I've been doing this a little bit, a while anyway. I am so honored to have this opportunity to tell you a little bit more about health services. So Health Services is located on the 5th floor of the administration building. We share the same area as Counseling and Disability Services. So when Terri talks to you about Counseling and Disabilities, we're all in the same wing there. I'm going to give you some, if you have a piece of paper, you might want to write down the phone number. I'm going to give you the number to our office. It's important to have this number. It is 724-838-4234. If you want to send us an email, it's pretty simple. It's just healthservices@setonhill.edu. So you're right now during the summer, we are open Monday through Friday, 8 to 4. However, during the fall, we will be extending our hours and we will be adding Saturday hours for testing. So, keep looking at our website. More information will follow as to which evenings we will be staying open late. So your health service team consists of myself, and also we have 2 registered nurses, Jackie Greathouse and Eric Schmadl. Both Jackie and Eric, they are former ER nurses. And so they have, a lot of good experience in emergency medicine. And they have, Jackie has been with us since last year, and pretty much Eric has been with us during that time as well. So besides seeing myself and Jackie and Eric, another person that you may see in health services, we're going to be having a medical student rotate through health service one afternoon during the fall semester. So that might be another person that you would get to see there. So in health services, we operate similar to your PCP, your primary care provider. So we go by appointments. And so to schedule an appointment, once you get your email set up, there's a home page of My Shoe. And when you scroll to the bottom of that page, there is a section for online services. And if you click health service appointments, you can get an appointment. You can select the date that you want to come in and also the time that you want to come in. Depending on the reason for your visit, a couple things may happen. We might send you a link for a telehealth appointment. If that is your preference and we are able to do the visit via telehealth, we would be more than happy to accommodate you that way. We may schedule you for an in-person appointment, but want you to get COVID tested first. So depending on your symptoms, right? So if you, say that like every time this year, you always get a sinus infection and this is a sinus infection because this is how you always feel. What we would do out of an abundance of caution, we would do a COVID test just to make sure, right? Because we know that all those symptoms of the sinus infection are the same ones that can occur when you have COVID. So we would just test you for COVID to make sure it's safe to bring you up to the 5th floor. Once we would get that rapid test back, then we would see you for your sinus infection. Another thing that could happen when you make an appointment, we may just refer you directly to the COVID testing area. If you give us some information, say, hey, I woke up, Now I have a loss of taste and smell. We know that is one of all the symptoms, that is one that is consistently seen in COVID. So we may refer you directly to that. You may be wondering, well, where is the COVID testing center? Where are we going to be testing? So for people who are going to be participating in universal testing, the COVID test it's outside and it's right in front of the administration building. So if you are a person who's going to be requiring universal testing, we will be giving you more instructions about where to go and also how to make an appointment for testing. Just so you know, all appointments, they're free. You can come as often as you want. Also, it's confidential. So if you are 18 years or older, we cannot release any medical information to your parents or your faculty without your written consent. So, we want you to know it's a safe place. You can talk to us about, anything that's on your mind. Now, if you are 17 years old or younger, it's important that you reach out to Health Services so we can email you a consent form. If you are 17 or younger, you are considered a minor. So we would not be able to see you or treat you in Health Services until we have a signature from either, your parent or your legal guardian. And that's really important. You never know if you might get stung by a bee or, step on something. You want to have this place, you want to have this in place before you come to school. There's nothing worse than, having an accident and then us trying to get a hold of a parent or guardian. It just delays your treatment. So, please reach out to us. Some of the services that we offer at Health Services, again, I'm just going back to the analogy of your primary care office, pretty much the same things. If you receive allergy injections, we will do allergy injections for free, as long as you are on your maintenance dose. So, if you are somebody who just started getting allergy injections and they're still trying to titrate you to your maintenance dose, we will not be able to do that. However, once you get on your maintenance dose, we would be more than happy to give you your allergy injections. Likewise, if you are somebody who needs allergy injections, please send us an email to healthservices@setonhill.edu, because there is a bunch of paperwork that you need to fill out beforehand. And likewise, your allergist also needs to fill out this paperwork. So again, you don't want to come to Seton Hill the first day. Here's my serum. I need my allergy shots. It's just going to delay your treatment. So if you fall into that category, please reach out to us. In addition to allergy injections, we also provide treatment for acute illnesses. So if you would have like a cold or bronchitis, I mentioned a sinus infection, urinary tract infection, we treat any type of dermatological condition. So if you have a rash or any lesions or a skin infection, we can take care of everything like that. We do offer rapid testing in Health Service. What that means is you get the results the same time during your visit. So a rapid test we might do would be a sore throat, strep test. Say you come in, I have a sore throat. I always get strep. I know it's strep throat. We would be able to test you for strep throat in the office and give you your results right then and there and prescribe you an antibiotic if it is a bacterial infection. And we call these point of care tests. And again, that's point of care is just a fancy term for you will get the results at the same time as your appointment. So we offer point of care testing for strep, for urinary tract infections, for the flu, and also COVID and mono testing as well. Now, sometimes we do need to send the lab test off for confirmation. And so if that would be the case, then we would need your insurance card, because that is something that would not be covered by Health Services. That is something that would be covered by your personal insurance. So whenever you make a visit to health services, please always make sure that you have a picture of your insurance card on your phone, because if you do need a prescription or if we do need to send a confirmation test off to the lab, it'll be really important to have that information easily accessible. So talking about, we mentioned strep throat, sinus infection, things like that. So as a nurse practitioner, I am able to diagnose and prescribe medications. Also, the two nurses that I mentioned, Eric and Jackie, we have protocols that they can work off, so they can also, prescribe medication under this protocol. So, so that's something that's important to know. Whenever we prescribe a prescription, if you want it delivered to health services, we can get it delivered for you. There's a pharmacy. They used to be called Hunter Pharmacy, but now they have changed hands and it's called Curtis Pharmacy. So if I would see you and say you do have strep throat and you need an antibiotic, I could send that prescription to the pharmacy to have it delivered to you on campus. So this way you would not have to, figure out where the closest CVS is. It would just come to health services and then you could come to pick it up. On that same thought, if you take a daily medication, so say you take doxycycline every day for acne, we could have, and you usually get your prescription filled at Giant Eagle in Scranton. If you bring your prescription to me, I can have your prescription transferred from your Scranton pharmacy to Curtis so they could deliver it on campus. So that's kind of a nice, a nice perk that if you do take a daily medication, that it can be delivered for you. Now, there's always exceptions to every rule, right? So there are some medications that Curtis Pharmacy cannot deliver. So for example, if you take a medication that is a controlled substance, you take a medication, for example, Ritalin is an example of something that could not be delivered to campus. But for the most part, all the antibiotics, medications for anxiety or depression, those all can be delivered to health services. So other things that we offer in health services, we also do referrals to other healthcare providers and specialists. So for example, say we are seeing you for some sort of dermatological issue. You have this really funky rash and, we're trying to treat it, and we tried like a topical steroid cream and it's not getting better. And maybe we've tried something else and it's still not getting better. At that point, we would contact a dermatologist, make sure your insurance is covered, and we would set you up with a specialist. So, if we can't figure it out in health services, or if it's beyond our scope as registered nurses and nurse practitioners, we will refer you to either another provider or a specialist. We also work really closely. We're still in the midst of this pandemic, so we have a really good relationship with the epidemiologist. She has been helping us a lot with, some of the planning that we've been doing as far as quarantining and isolation and things like that. So with health services, we're kind of a multidisciplinary team. We work with Terri in Counseling and Disability Services. We work with Residence Life. We're kind of a part of a really larger picture here. So, and another thing that we are responsible for, which you probably all know, and hopefully you guys have all completed your immunization requirements, that is really, really important. If you're not sure, or if you have any questions, please send an email to healthservices@setonhill.edu. Because what is important to know that students who fail to upload their vaccination card or submit a request for exemption will not be permitted to access the residence halls and attend classes until this is complete. So if you are a commuter student, you don't have to worry about accessing the residence halls, but you will not be able to attend classes. So, I urge you, if this is something that you're still working on, please try to complete this as soon as possible. If you have any questions about how to do this, reach out to us. We're here for you to help you. On MedProctor, you may see we do have like an immunization verification form. You can download that and take that to your primary care doctor to sign, or when you go to your doctor, just ask them to print off your immunization records. Those will be accepted as well. The only thing that we cannot accept is the school nurse records. So some of you, when you graduated, you may have gotten those little green cards from the school nurse. And the reason why we can't accept them is because, they were just copied from something else. So we need the original documentation. If any of you on this webinar tonight are PA students or nursing students or an athlete, you have to not only upload to MedProctor, but if you're an athlete, you have to upload to this thing called ATS. It's an athletic training database. If you're a PA or a nursing student, you have to upload to their platform, which is Council Branch. So I've been getting this a lot. People will say, well, I'm an athlete, I uploaded to ATS, or I'm a PA student, I uploaded to Council Branch. Do I have to upload it to MedProctor? And the answer is yes. Unfortunately, these platforms do not speak to each other. I wish they did. It would save us all a lot of time, but unfortunately, they do not. So things that I want to tell you that are coming up, if you are local, we are having another COVID vaccine clinic on campus. It is on July 30th. So if you, as you know, we have mandated the COVID vaccine. So if you have not gotten your vaccine, that is an opportunity for you to come on July 30th. We will be offering both the Pfizer vaccine, which is a 2-dose series, and the J&J vaccine. If you are waiving your COVID vaccine, if you're applying for a medical or religious exemption, please, submit that, upload that to MedProctor as soon as possible. Because once you submit that, then it is reviewed by a committee. So again, don't wait until move-in day, because move-in day, we won't be reviewing immunization exemptions. So you've got to get that in. Other things that are coming up that are important to know, we will be having a flu clinic in the fall. So, if that's coming up in October and November, you can kind of stay tuned for dates. We are sponsoring a blood drive in September. So if you are able to donate blood and support this life-saving event, that would be really great. And let's see what else. Other things I guess I would like to say as far as Wellness Wednesday, I would like, whenever you do come to school, if you could pack yourself like a little first aid kit, that's going to be really important. Pack yourself some, if you have a thermometer. One of the things that we require students is to do a daily self-screening. So we want you to be checking your temperature every day, because if you have a fever, we're going to want to test you for COVID, whether you're vaccinated or not. We're going to be testing everybody. So, bring a thermometer, bring some, maybe if you like Gatorade, some Gatorade, or, some juice, something that you can have in the event that you do get sick. Because what's worse than, having a fever and being congested, and it's like, well, geez, I wish I had some Tylenol in my room. I wish I had, cough drops. So, pack yourself up some cough drops, some Band-Aids, some microwavable soup, any of like those little extra touches. I think it would be good for you. We do have some over-the-counter products in health services. So certainly you can, reach out to us. But if it's Sunday and nobody's on campus, you won't be able to get it from us. So that's why it's always good just to have, a stock of your own. And the only other thing I'd like to talk about just very briefly is universal testing. Everybody is, if you are not vaccinated, or if you are not fully vaccinated, So fully vaccinated means 2 weeks past your second dose if you got the Pfizer or Moderna vaccine, or 2 weeks after the single dose J&J vaccine. If you are not fully vaccinated, then you have an exemption and not getting vaccinated, you will need to participate in universal testing. And universal testing just means on arrival to Seton Hill, you will need to have a COVID test. This is something that is paid for by the university, so it's nothing that you are responsible for, but you will need to quarantine, which means, stay in your room until we get the results. So quarantine, probably is going to take about 2 to 3 days. If you are vaccinated, you will not have to do this, unless, of course, when you're coming to school, if you have symptoms, then, we'd want to test you as well. So, more information will be forthcoming about the dates. It's my understanding that Corey from Residence Life has already emailed everybody about, dates to move in. So if you have any questions, please, again, just reach out to Health Services. And I think that that's everything that I have for now. So I'm going to turn it over to Terri, who's the Director of Counseling and Disability Services. And thank you for your time.
So thanks, Annette. And I'm going to focus tonight mostly on counseling services. We had a session last week that was on disability services. So that information got covered last week. So Annette really just covered a lot of stuff about trying to help you stay physically well. And our area in counseling services is to help you stay emotionally well, to stay mentally well. And so we have counselors on campus available to meet with you. This is different than your guidance counselor at school. We're not guidance counselors. We're trained in psychological services. So if you've been working with a private therapist, that would be very similar to the counseling services on campus. Right now, our counselors are myself, Sarah, and Samantha will be joining us in August, I guess, just a month from now. And so we're going to have 3 individuals who will be available to meet with you. We'll also probably be adding another counselor to our staff at some point during the fall semester. So there's a variety of people that you can meet with. Our offices are in the administration building, and we're both on the 5th floor and the 4th floor of the administration building. And our services are free, they're confidential. Typically, we would meet with students once a week, but sometimes students will choose to meet every other week, or maybe even just occasionally once a month or something like that. So our appointments with the counselors are, as Annette had said earlier, they're by appointment. And so if you go onto that MyShoe homepage, we also have a link there where you can click on and find out counseling availability. Just pick whatever counselor you want to work with, find a time that works with your schedule, and you're all set. We're going to offer both in-person and tele-counseling appointments. So if you would prefer to meet remotely, if you are a commuter and you're at home, you don't want to come up to campus, and you want to have a tele-counseling appointment, that's great. If you don't have enough time to travel between classes to get to an appointment, or if it's just your preference. So telecounseling will remain available this year, and we'll also have in-person counseling, which means you sort of come to our offices to talk. We do have 24-hour availability, and that's for crisis support. So our office hours are basically 8 a.m. to 5 p.m. Monday through Friday. But if you find that you really need to talk to somebody in the evening or on a weekend, that you just got yourself mentally in a bad spot, we do have on-call staff who are available to meet with you. And all you need to do is reach out to one of the Residence Life staff, tell them that you want to talk to one of the counselors. They'll ring us up and we'll get connected with you pretty quickly. What kinds of things might you want to talk to a counselor about? Well, I'm going to say that's soup to nuts. We are open to talking to you about anything. That could be that you want to talk about your 4-legged siblings that you left at home that you're missing. You might want to talk about family. You might want to talk about friends. You might be feeling sad or lonely. Maybe you're struggling around managing food or those kinds of things. feeling depressed. All of those things are open for conversation for us. We would never turn down any type of conversation that would be helpful to you. So always feel free to step in and talk to us about things. Again, I said it's a confidential service, and it is a little bit different than what you're perhaps used to with guidance counselors. We will not talk to your parents. We will not talk to faculty. We will not talk to other staff. We will not talk to your friends unless you ask us to do that. The exception to that would be if you have intention to harm yourself or someone else, we obviously would be taking whatever measures were necessary to make sure that everybody stayed safe. But outside of those two parameters, we will not say anything to anybody. We're also going to do some promotional kinds of things just to try to help students understand what counseling is. So we're going to have this virtual drop-in a couple times a week where students could just log on and come into a virtual room and just maybe try it out. Or maybe you don't really want to engage in counseling, but you have a question. This would be a place that you could go and just ask a question. Or maybe you want some advice about how to handle a situation with a friend or a roommate or something like that. So these drop-in sessions, we're going to call them Let's Talk, and they're going to be every week for a couple hours, a couple days a week. So that will be available to you. And then every day of the week, we also set aside at least 1 hour for a walk-in. And that would be, boy, I didn't schedule an appointment because I didn't really know I was going to have a crappy day, but I'm really having a crappy day and I'd like to talk to somebody. So we set aside an hour or two every day that you don't have to have an appointment. You just come in and we talk it through. So that's sort of what counseling services are all about at Seton Hill. And I know maybe, Jennifer, we have some time for some question and answer. If the students have anything for me or for Annette, we've been at the university for a long time. We can answer some questions about health services or counseling services. Quite frankly, if you want to throw something else at us, we might know the answer to that as well. So feel free.
Does anyone have any questions for Annette or Terri? You can either unmute yourself, or if you'd like to throw them in the chat, you're more than welcome to do that. Any questions?
Hannah's shaking no. Okay.
As you think of questions, what I'll do is I'll go over some of the upcoming virtual orientation events that we have. As we've mentioned before, there are a total of 28 virtual orientation events. Crazy to think we're already at 19, but there's still a ton of events that you can come to this summer. So that way you can get used to Seton Hill and learn more about us. You can either look to this awesome Road to the Hill flyer, or if you want to go on the website, which is roadtothehill.setonhill.edu. Our next event is tomorrow night, July 22nd at 6 p.m. This is our transfer student panel. So if any of you here are transferring to Seton Hill, this session will feature a panel of students and staff members that will help make your transfer to Seton Hill as smooth as possible. And afterwards, you'll also have an opportunity to ask questions. On Saturday, if you have not attended one of our Welcome to the Hill sessions, our last Welcome to the Hill session is July 24th, this Saturday at 10 p.m. This is an opportunity for you to really see Seton Hill at a glance in a 2-hour-long program. All incoming students are required to come to at least one of these sessions. We had a Welcome to the Hill session in May. We also had one in June, so this is our final one happening July 24th at 10 a.m. And this will also ensure that your check-in process goes as smoothly as possible. So as long as you attend one of your Welcome to the Hills, you'll be ready and set to go. Also on Monday, July 26th, we have our Mission Monday. And this is where members of the Division of Mission and Identity will discuss the core of what makes Seton Hill so special. Campus ministry, service, and many other facets of the Setonian 4 pillars will also be discussed as well. So we really hope that you come to any of our virtual orientation events that we have remaining. Any questions that you have before we turn off the Zoom recording? Alrighty, well, we really want to thank Annette and Terri for taking the time out of their schedules today and presenting so much wonderful information related to Wellness Wednesday. I will turn the recording off, so if you have any questions that you want to ask after we turn the recording off,